All right. So again, good morning. Welcome to the annual Parity and Behavioral Health Legislative Policy Briefing, co-hosted by myself and Lori Marie Peixoto. Just a little background about me. I'm Beth Lamar. I'm the executive director at NAMI Rhode Island. NAMI Rhode Island is the state organization of the National Alliance on Mental Illness, where we provide programs for peer-based support for individuals who are living with mental health conditions and their loved ones and the broader community, just to educate and provide advocacy around matters of mental health conditions and mental illness. And also, I'm sorry, I'm getting a note that I'm not sharing screen yet. Um, hmm. Doesn't want me to either. There we are. Okay. Um, Sorry, I'm having some technical difficulty here. Yes, Lori, if you could share, not seeing my screen. Thank you.
Mhm. Uh,
Hopefully it'll cooperate for you. Excellent. Lori saves the day. Okay, so as I was saying, NAMI Rhode Island provides peer-based programs for individuals living with mental health conditions, their loved ones, and the broader community in order to spread education and awareness, decrease stigma around mental health conditions, and just to help other individuals lead their best lives in living with mental illness. And I'm going to turn that over to Lori to talk about her organization.
Thank you so much, Beth, and thank you everyone for joining us today. We appreciate your participation here and also your interest in mental and behavioral health policy. Um, I wanted to introduce myself. I'm Lori Marie Peixoto. I'm the Executive Director of the Mental Health Association of Rhode Island. And for those of you who are not familiar with us, we are a private, nonprofit consumer advocacy organization. We were founded more than 100 years ago by a gentleman named Mr. Clifford Beers. And Mr. Beers was a Yale graduate, he was a Wall Street banker, and he lived with serious, persistent mental illness. In fact, he lost his three siblings to suicide. Mr. Beer spent a considerable amount of his adult life living in what used to be called asylums. And back then, asylums were filthy and overcrowded and dehumanizing. People could be caged, people could be shackled in place with iron shackles. It was horrific. And he wrote an autobiography called A Mind That Found Itself. And it chronicled his time in asylums. And physicians across the country read his autobiography and felt moved to take action. And they worked with Mr. Beers to ignite a second wave of mental health care reforms nationally. And while he was doing this advocacy, he was advised to not share his personal experience with mental illness for fear of stigma and discrimination. And he politely rejected that advice and said, "No, I will fight in the open." And so that is our national motto, fight in the open. And after these reforms were passed, he asked the asylums to send him their iron shackles, which he collected and melted down into what's called the Mental Health Bell of Hope. And that's why you'll see a bell depicted in our logo. And the bell still exists actually at our national headquarters called Mental Health America, based in Virginia. So today I follow in Mr. Beers's footsteps. I am a person with lived experience of mental illness. I talk publicly about this whenever I have the opportunity, so that everyone who might be experiencing a condition knows that they're not alone and there's no shame in it. And hopefully this helps increase empathy and understanding and decrease stigma and discrimination. So Mental Health Association of Rhode Island, our mission is to improve the system of care through policy development, advocacy, education, and coalition building.
So each year, Lori, Marie, and I get together and we talk about the priority areas that we would like to see legislation moving through the state of Rhode Island. And we compartmentalize those into four different areas so that we can speak about it in a way that is most accessible for others who maybe aren't as involved in the legislative process. And so those four umbrella areas that we're going to be discussing today are increasing equitable access to behavioral health care, supporting youth mental health, ending the criminalization of mental illness, and investing in prevention measures. And the reason that it is so important for us to be doing this work is because of the statistics of the number of people who are impacted. So, as you can see on the screen, 23.1% of adults had mental illness in 2022, according to NIMH. And then 50% of all lifetime mental illness begins by age 14, 75% by age 24. And that's a statistic that comes from our organization, NAMI. This is really important because, as you'll see through the four areas I talked about, a lot of what we're discussing revolves around prevention and revolves around establishing a good system for mental health, which means that we could decrease these statistics if we had better systems in place.
And so, to follow what Beth has just explained to us, I think it's important to contextualize where Rhode Island's behavioral healthcare system stands today. There have definitely been significant improvements over the last 5 years, especially since the pandemic, which I guess the positive you could say coming out of the pandemic was that it heightened awareness around mental health conditions, including substance use disorders. But today, Rhode Islanders continue to experience wait lists when they reach out for services. We continue to overutilize emergency departments and hospitals. People continue to be discharged from emergency departments without necessarily having a place to go after they're discharged. Um, Psychiatric hospitals have been known to prematurely discharge patients simply because they have a list of people waiting for that bed. And we know that forensic patients are stuck in prisons and also in Eleanor Slater Hospital, where they may not necessarily need that level of care, but don't have community services. And other patients are also maybe stuck in Eleanor Slater Hospital, where they would benefit from something like a psychiatric nursing home. But Rhode Island doesn't have any psychiatric nursing homes. And so these individuals are stuck in Eleanor Slater Hospital, which is a restrictive level of care. And that's not to say that Eleanor Slater Hospital should not exist, because some Rhode Islanders really do need that level of care. It's more to say that we need a full continuum of care, everything from outpatient services all the way up to state psychiatric hospitals and an Eleanor Slater Hospital and everything in between those two. And part of the causes for having a broken continuum of care in our state is, yes, the pandemic did increase demand for services. However, I recall that when I moved back to Rhode Island in 2018, I tried to find a new therapist, and I had a specific area of expertise that I was looking for. And the two that seemed the most qualified and experienced, one had a 3-month wait list, and the other had a 1-month wait list. And luckily, I got in sooner than that. But that is to say that prior to the pandemic, we also had wait lists. This is not a new phenomenon in our state. Um, it's great to see the General Assembly is really taking interest in the behavioral healthcare system and investing more dollars than they ever have, or at least than they have in many years. But we still need to invest every year. We're kind of making up for a deficit at this point in our behavioral healthcare system. And we know that low reimbursement rates, which is what health insurance companies pay behavioral health professionals for their services, we know that those low reimbursement rates contribute to staffing shortages in our health and human services sector. And so when we don't have enough providers in insurance networks, patients have to consider, can I pay out of pocket or do I go on a wait list for an in-network provider, or do I give up? And so none of those three choices are good. And we want to see that patients and Rhode Islanders can get in to see whatever level of care that they need when they need it. And I'll mention nationally, we have a shortage of psychiatrists because of all the specialists, if you think of cardiologists and rheumatologists and dermatologists, psychiatrists really aren't paid as well as the other specialties. And so we've had more psychiatrists retiring across the country than are joining the field. And that's something that needs to be addressed through our health insurance companies and also state funding. So first, let's talk about pieces of legislation that would increase access to behavioral health services in Rhode Island. I think it's important to touch on parity. And what do I mean by parity laws? Um, Parity refers to federal and state laws that require health insurance companies to equally cover medical and behavioral health services. The law was passed in 2008 at the federal level. We also have a Rhode Island version of a parity law. And these laws prevent health insurance plans from imposing more restrictive requirements on accessing behavioral health services and treatment than they do medical services for physical ailments. So there are quantitative measures of parity and there are qualitative measures of parity. As an example, a quantitative measurement of parity would be if your health plan gives you 100 days in the hospital for a medical condition, it must give you 100 days in the hospital for a psychiatric condition. Now, the gray areas are the qualitative measures of parity, and this is what a health insurance company can exploit. So, for example, a health insurance plan might deny coverage for a service because they'll say that it's not medically necessary. But they get to define what's medically necessary. And what they think is medically necessary may be different than what your mental health professional thinks is medically necessary. And so this is how health insurance companies can delay services, limit services, and even deny services. And why do they do this? Because they believe that restricting services will save them money. However, we know that this isn't true. We know that when Rhode Islanders are able to access services in a timely fashion when they need them, it improves patient outcomes. And when we improve patient outcomes, we reduce the utilization rates of crisis services and emergency departments and hospitals. And these are all very expensive levels of care. So when we make services easy to get at the onset of an illness, we reduce the likelihood of having to pay for the more expenses of care, and then health insurance companies and Medicaid, and we all save money in the end. So the next three bills that I'll talk about today aim to strengthen Rhode Island state parity laws. The first one is sponsored by Representative Tanzi and Senator Uji Fusa. This one will expand consumers' access to services by providing insurance companies a generally accepted standards of care definition that they must use. And the generally accepted standards of care, if passed, if this bill passed, would be defined by clinical experts in those relevant fields of study. So, social workers, psychiatrists, psychologists, mental health professionals, they would define what the generally accepted standards of care are, and health insurance companies would have to follow them. It would also prohibit insurers from deviating and having their own definitions of what's accepted standards of care. And these two bills have already been heard in their committees and they're being held for study. And what that means is that they're sort of in a legislative limbo. Held for study means that they are just sitting there. It has not yet been decided if they will be voted on in a committee. And if they're not voted on in the committee, they can't get to the House and Senate floors to be voted on by the larger General Assembly chambers. And so there's still an opportunity for activism here. If you care about these bills, you can still submit an email, a letter, or a phone call to the committees where these were heard. And if you want more information on how to do that, I have written instructions and would happily email them to you. You can just shoot me a message in the chat. So this one, again, would define standards of care. The second piece of legislation is fantastic, and it eliminates prior authorization for in-network behavioral health services. This would increase access to timely services, which would prevent a crisis from unfolding and which would reduce the likelihood of using those expensive levels of care, like emergency departments. Um, this is also introduced by Representative Tanzi and Senator Uji Fusa. And it's worth noting that Blue Cross and Blue Shield of Rhode Island has had this policy in effect, I believe, since 2019, and it came out of a market conduct exam from the Office of the Health Insurance Commissioner. And so this piece of legislation would require all commercial health insurance companies to have the same policy in effect, so that all Rhode Islanders who have commercial insurance would have equal access to behavioral health services with, reducing this extra barrier. These bills have also been heard in committee and are held for study, and that means you can still send a letter to support them. And the last parity bill would increase outpatient behavioral health provider services rates. And why would consumer advocacy organizations like NAMI and Mahari care about how providers are paid? Well, we care because when insurance companies underpay mental health professionals, those mental health professionals stop taking insurance because it costs more to deliver the services than they're able to recover in reimbursement rates, and it puts their practices at risk. Other providers might retire early or might even move their practices or gain employment across the border in Massachusetts where their rates are higher. And so all of this means that we have fewer in-network behavioral health professionals for people like me. And so when I reach out to ask for help and for services, I'll be placed on a wait list for weeks or months, and that's really unfortunate when someone's reaching out for help and they're already having a struggle. To hear that you have to go on a wait list can be very demoralizing. So, this piece of legislation, if passed, would help increase and retain the in-network behavioral health providers that we have in Rhode Island, and again, would increase access to services and reduce utilization of expensive levels of care. These bills have been heard in committee and are also being held, and you can still write an email to support them.
The second, excuse me, the second area of legislation that we were focusing on is the support for children's mental health. And the reason that this is important is because we know that 1 in 6 youth in this country between the ages of 6 and 17 experience a mental health disorder each year. And as we mentioned at the beginning of the presentation, half of all mental health conditions begin by age 14. And only about half of youth with mental health conditions are actually receiving any kind of treatment within the past year. So, undiagnosed, untreated, or inadequately treated mental illnesses can, of course, interfere with a student's ability to learn, to develop, to thrive. And since children spent most of their time in school settings and educational settings, this is a unique opportunity. We talk about in both of the bills I'll be mentioning student mental health. And that's because it can take away barriers such as transportation, scheduling conflicts, stigma in accessing services in a community. If everyone has access to it in school, then it's become more normalized. And children who have more serious mental health needs might also require different services that would be linked to the services that they're receiving in school. So overall, it would increase academic achievement, which is an important indicator of a child's overall functioning, and will also increase mental health services, not only in schools, but in the community, which also shows the students and the family that their school district, their town, their city support them. We also know that early identification and effective treatment for children and their families can make a difference in the lives of the whole family. So there are two bills that we will be looking at. The first of which is expansion for school psychologists, which is being supported or was introduced by Rep. Anthony DeSimone. There's currently no companion bill in the Senate, so that is an opportunity to reach out to your local legislators and educate them about that. This proposed bill would include licensed school psychologists under the provisions of general law for all psychologists and would also expand the licensing of school psychologists for independent practice. In other words, broadening their reach to the community, not only within the school setting. This also increases access to mental health services for youth who have no other access point. Perhaps there is no other way for them to receive services in the community. And right now, the ratio of students to school psychologists is 763 to 1 in Rhode Island. The recommendation is a maximum of 500 to 1. And that, like I said, is an average. We know that it can be in excess of 1,000 to 1 in many urban school settings in this state. So the purpose of this bill would be to address this shortage of school psychologists that we presently have. It would also improve the academic, behavioral, and social emotional well-being of children and youth by increasing access to school-employed mental and behavioral health professionals and community access, like I said, to those services for the families. So, in the bill language, it says that it would ensure that the state also fulfills its obligations to state and federal laws that address students with disabilities, school safety, school climate, and social emotional learning. The second bill is funding for student mental health. And this was introduced in the House by Rep. Jenny Azanaro Furtado and in the Senate by Senator Melissa Murray. This bill mandates additional state education funding for mental and behavioral health students that is equal to 2% of the district's total expenditures and require those funds to be used to hire staff like school social workers and behavioral health specialists. It also increases access to service and promotes equity across communities by giving all districts this opportunity. So state-based funding to help enhance what it is that the district is presently doing. And from the bill language, I just want to read this part. It says it would amend the current law to mandate additional state education categorical funding for the mental and behavioral health students equal to 2% of the district's total expenditures, and would further mandate that those funds be used to hire and retain staff such as school social workers, school counselors, psychologists, paraprofessionals, behavioral health specialists, and registered behavior techs. And this is intended to not replace the funding or the spending that those districts are presently doing. It would enhance and increase what they're already having to offer. So in every case, in each district that this would apply to, they would be able to expand services. It is not 2% of that expenditure to help offset their existing costs. So that's very important that in every city and town that would receive this funding, they would be able to increase service. The third category that we focused on is the ending of the criminalization of mental illness. And I'm just going to tell you a little bit about why this is important, and then we can look at the bill. We are of the belief that no one should be subject to practices that can cause or worsen one's mental health symptoms. NAMI as an organization opposes the use of solitary confinement and equivalent forms of administrative segregation for people with mental health conditions. And when Lori and I were preparing this presentation, we both wanted to highlight that both our organizations promote the complete abolishment of the practice of solitary confinement. And the bill that we're going to discuss is just a very good first step to that end game. So solitary confinement, if you don't know, is the placement of individuals in locked, highly restrictive, and isolated cells or other similar areas of confinement with limited to no human interaction and few, if any, rehabilitative services. Nationwide, or actually probably worldwide, that solitary confinement could last for weeks, months, or even years at a time. And of course, during that time, it just becomes more and more detrimental to one's mental health, even if there were no pre-existing condition. Solitary confinement is used extensively in correctional settings, rather, for people with severe psychiatric symptoms. In fact, there's a stat that 8.6 of all individuals who are held in segregated settings are diagnosed with a serious and persistent mental illness. The use of solitary confinement, whether that be for disciplinary purposes or what is intended for the individual's protection, can cause extreme suffering. It can cause or worsen symptoms of depression, anxiety, even hallucination. It disrupts treatment, whether that be mental health treatment or overall medical treatment. It can impede rehabilitation while in the prison setting and therefore impedes community reintegration when the person is ultimately released or discharged from the setting. It can also, of course, cause adverse long-term consequences for cognitive function. And so both of our organizations, promote alternative disciplinary, corrective, and protective um, settings and practices rather than solitary confinement. So just to discuss the bill that is before us this year is known as the Restrictive Confinement Oversight Act. That is a fancy alternative for saying solitary confinement. And this is introduced in the House by Rep. Leonela Felix and in the Senate by Senator Jonathan Acosta. As you can see, this bill is being held for further study, which, as Lori Marie mentioned earlier, is a bit of legislative limbo, gives opportunity for further advocacy. And this bill would establish a restrictive housing oversight committee for the purpose of monitoring the use of solitary confinement as well as disciplinary and administrative confinement within the Department of Corrections. So, what we are hoping is if that were to be passed, not only does it establish that committee, but also an ombudsman who would assist in its oversight. So, somebody who is liaising. And then hopefully, through that review, decrease the practice of solitary confinement in any situation that the committee deems it to be unnecessary.
Investing in preventive measures. I think we can preface this part of the conversation by saying doing nothing is not free. Yes, our leaders are facing perhaps federal or state budget cuts, but it's worth noting that investing in things like health and human services pay dividends into the future. When we make it easy for people to live in supportive housing and get all of the support and services they need, when we provide easy, timely access to outpatient services and partial hospitalization, we reduce expenses in the long term. We reduce the utilization of hospitals and number of individuals who will become homeless because they lack appropriate supportive housing. We reduce the utilization of the criminal legal system. And so while all of these investments are definitely an expense up front, over time, they do save money. And if we practice dynamic budgeting, we would see that. We would factor those savings into discussions about how we'll spend today's money. And so that's how I want to proceed with the next few slides, bearing that in mind. So it took several years, but Rhode Islanders are finally getting an Olmstead plan. Olmstead refers to a 1999 United States Supreme Court case that ruled states have an affirmative legal option, a legal affirmative legal obligation, pardon me, to ensure that people who live with disabilities or people who are at risk of unnecessary institutionalization have access to services and support so that they can live and work and receive services in the least restrictive setting of their choosing. So we can think about a person with a disability who might require some services, perhaps home-based services, nurses coming to their home to deliver medications or whatever. And without those home-based services, that individual might be forced into a nursing home when they really don't need that level of care. And that's not the level of care they would choose for themselves. And so that's a practical example of what Olmsted means to the average Rhode Islander. You know, we're all getting older. Any of us could face an illness or a disability or an accident at any time. And none of us would want to see ourselves or our loved ones unnecessarily institutionalized. And so we're getting an Olmsted plan. The state has done a phenomenal job of staffing the development of this plan. They invested in consultants, they invested in an Olmsted coordinator who did a fantastic job of creating a state and community partnership to help draft the plan and prioritize what would go into the first plan. And I'm so excited that the plan will be finalized by the end of this month, I believe. But what's missing from the Executive Office of Health and Human Services fiscal year 2026 budget is funding to continue keeping that Olmsted coordinator on staff. And that's a shame because this position, this role was instrumental in getting Olmsted off the ground in Rhode Island and making sure that the community had ample opportunity for input and participation. And it would be a shame to see all of that fall by the wayside because we don't have the funding to keep that going. And so it's not too late. You can still write a letter to the House Finance Committee and the Senate Finance Committee and ask them to add some additional funds to retain the Olmsted staff that we currently have, so that we don't lose the momentum, and we can keep moving forward with Olmsted. And again, when we invest in the resources and services needed to keep individuals out of unnecessary institutionalization, it certainly saves money in the long term. Because think about it, it's less expensive to provide home-based services than it is to pay for a nursing home each month. And so it just makes good sense that we should invest in these things. It also puts us in compliance with the Americans with Disabilities Act, and that's important. The 988 Suicide Prevention and Crisis Line is so important. This is an unfunded federal mandate, meaning that the federal government requires that every state have a 988 line 24/7. Now, states that choose not to invest in their 988 lines or maybe not invest enough funding, residents that call that state's line will be rerouted to a 988 line in another state if there's no one in their own state to pick up that phone. In Rhode Island, we have an exceptional call answer rate. And the folks at Horizon Healthcare Partners and our other partner organizations who are doing this work with 988, they pick up on like the first ring. They don't even let it get to a second ring. And you should also know that it's not just suicide prevention. You can call 988 if you or a loved one is experiencing a crisis and you're looking for referrals or information or resources. And they are available 24/7. And again, you'll be talking to someone who's from Rhode Island and knows what's available in Rhode Island and knows where to direct you to, rather than Rhode Islanders' calls getting answered from Nebraska or Ohio. And so there's legislation that would create a sustainable source of funding for Rhode Island's 988 line. Again, it's an unfunded federal mandate, so we've got to figure out how to support this on our own. And so this piece of legislation would take the surplus of what's left over, what is unspent from the first responders fee, which is already a fee that we're all paying on our cell phone bills. And so It would take whatever's left over and hasn't been spent by 911 and apply it to 988. So it's not taking away from 911. It's simply taking what's left over from 911 and applying it to 988. And Representative Shallcross Smith and Senator Melissa Murray are the sponsors of these bills, and it's not too late to send a letter supporting them. CCBHCs, if you've participated in these policy briefings in the past, you'll probably recall Beth and I talking about them. This is a federal initiative, and it's really an important part of our continuum of care. These are outpatient community health centers. They often integrate primary care with behavioral health care. Um, they provide crisis services. They do screening and testing. And they're supported by a unique funding mechanism, and that is a prospective payment model in which Medicaid pays the providers or the clinics for their anticipated costs, for what they're actually spending to deliver the services. And this makes this model more financially sustainable for the long term. What's interesting to note is that this is a really funny area because this is like the one place in our continuum of care where Medicaid pays more than commercial insurance rates. And that's a problem that needs to be addressed for CCBHCs to be financially sustainable. Because right now, when a person enters a community behavioral health center and they have commercial insurance is paying for the services at a lower rate than Medicaid. And so CCBHCs are losing some money when they're delivering that service. And it's also worth noting that commercial insurance doesn't even cover all of the services that are provided at CCBHCs and are covered through Medicaid. And so when a person with commercial insurance is getting services at a CCBHC, if their commercial insurance doesn't cover that service, then that cost is eaten by the CCBHC, and that also threatens their financial viability for the long term. And so, what we're asking is that commercial insurance rates at least come up to the level of enhanced Medicaid rates at CCBHCs, and that the commercial insurers are required to cover all of the services that are provided by CCBHCs. And funding for CCBHCs is found in the budget for the Executive Office of Health and Human Services. That hearing already happened, but it's not too late if you wanted to submit a letter to the Senate Finance Committee or the House Finance Committee. So, whether you are a legislator, a leader in the community, a person with lived experience, a family member, caregiver, you can help. You can help stand up for Rhode Islanders' access to mental and behavioral health care services. Legislators can help by prioritizing and supporting these pieces of legislation and these items in the budget, by talking them up with your colleagues and with the leadership of the General Assembly, by talking about them in conversations with your constituents in any town halls you may have, and keeping in touch with and engaging with folks like us in the behavioral health community who are doing this work, and also people who are receiving the services. If you are a person with lived experience or a family member, caregiver, you can help by sharing your story with Rhode Island's leaders. Um, there's training available if you would like. I know NAMI has a program called NAMI Smarts for Advocacy, where they will help you develop your story and give you tips for making the stories compelling and how to handle feelings that may come up when you're delivering your story. And that can be found on NAMI's website, or you can get in touch with Beth after this presentation. Even without NAMI Smarts, you can always send a letter to your elected officials. And that's so important because it helps build empathy. It increases their understanding of what Rhode Islanders experience when we try to access services and the barriers that we're facing. And, our loved one who might have sat in solitary confinement for weeks or months. All of these stories, if we're willing to share them, humanize these issues, and they build understanding. And that's what is really needed for societal change, cultural change. You can also stay in touch with NAMI and with Mahari, subscribe to our newsletters, which you'll find on our website. You can attend our meetings and you can support our work.
That said, here is all the contact information for both of our organizations. We've both put emails that you can reach us specifically, as well as our general office phone numbers. Our websites are both listed there. On those websites, you can find our other programs and services, our upcoming events, which is very important as we're moving into May, which is Mental Health Awareness Month, and there are quite a lot of things coming up. Also, you can use that website, each of those websites, to sign up for the newsletters that Lori Marie mentioned, which will keep you in the loop on all those programs and services. But also, you'll receive action alerts regarding legislation and what you can do. And also the program that Lori Marie mentioned of NAMI Smarts. If you go to the NAMI Rhode Island website, you can find info there about that. And that does help folks to tailor their story if you're interested in telling a story of personal lived experience. But also, it's just generally educational. There is a broad training program, but there are also specifics on things like healthcare parity or how to advocate for budgets. So all of that info is on these slides. When you receive the slides, those will be live links. You'll also have the recording of this presentation. So I don't see any present comments and questions in the chat, but I wanted to open this up for all questions and comments. If you have one, if you could raise your hand, like your digital hand or your actual hand, or if you could pop a comment in the chat, we would love to address any questions and comments. Karen Jeffries, I see your hand popped up before I saw any others, so.
Oh, thanks. And thank you guys. This was awesome. This was great information, and especially your story, Laurie Marie. I didn't know that history, but I just wanted to also offer every Tuesday at 3 o'clock, the HHP partners are at the State House. We meet at 3 o'clock in front of the library. So we're welcome anyone. If it's your first time, we'll help you, navigate the State House. So we're there every Tuesday at 3 o'clock, and we'd love for people to join us.
Thank you, Karen.
Beth, I'm having trouble raising my hand. This is Colleen Joubert. I just wanted to mention, somebody mentioned in the chat that CCBHCs see people right away, but I wanted to reference that CCBHC is a Medicaid program. So even though we will see people with commercial insurance, that is an issue for us, and that we are advocating for commercial insurance to pay the same rates that Medicaid pays, for that reason.
Absolutely. Absolutely. It is a wonderful resource in the community, but it won't be a sustainable resource if we can't make those changes. Thank you, Colleen. Lori Marie.
Thanks, Beth. Thank you, everyone. I just want to invite you to at least 3 events that I know of. May is Mental Health Month, and NAMI and Mahari do have some events coming up. We'd love for you to join us. First, May 6th, Tuesday, May 6th at the State House at 2 o'clock, we will kick off our annual May is Mental Health Month celebration. We will present awards to Michelle Taylor of Community Care Alliance, Barbara Morse of NBC 10 News, Senator Louis DePalma, and Representative David Bennett. We will also hear from a wonderful group of people with lived experience who will share their stories and inspire hope. And it will be a really fun event, and there will be an advocacy opportunity after if you're willing to stay. Again, it's from 2 o'clock to 3 o'clock, the State House on the second floor. The next event, I believe, is May 29th. And Beth, do you want to talk about it?
Sure. I have two. I have at least two events that I wanted to mention. So before I get to that, earlier in the month on May 9th, NAMI Rhode Island is collaborating with an event that's going to be held at Providence College and is hosted by a handful of Rhode Island-based running clubs for a Blue Jean Mile. And the Blue Jean Mile is a locally based initiative, or at least it was started locally and is becoming a national event whereby participants run or walk or move at their own pace 1 mile around a track wearing denim. And it was founded by someone who lost their brother to mental health issues over time and decided that he wanted to break a record so that he could establish the record in memory of his brother. And now it's become like an initiative. So we love that they reached out to us and that they want to work with NAMI. If you're interested in getting involved in that and you like running, or like me, you like walking at a leisurely pace, feel free to contact us and we can put you in touch with how to register for that. Also, the other event that Lori Marie mentioned is the annual NAMI Rhode Island Bridging the Gaps Conference, which will be held on May 29th at the Crown Plaza in Warwick. And the Bridging the Gaps Conference brings different sessions to individuals who are living with mental health conditions, for individuals who have a loved one that is, as well as individuals in the greater community and who work in the field. So for every breakout time frame, there are sessions that would apply to any of those folks. So anyone who's interested in the topics of mental health for any reason, we would love to have you. The registration is not yet open, but you can watch the NAMI Rhode Island website for more info, or if you're not already subscribing to our email list, then you can join that and you'll receive information as soon as registration opens. We are still also soliciting for sessions. So if you run a program or have an idea about a presentation, we are accepting proposals for sessions to be held at that conference. You can email me directly and just pitch your idea and say, I'm from such and such organization. We would love to do a session on fill in the blank. If your session is chosen, which as long as it is pertinent to the field of mental health and we've not already booked a session on the same topic, you would be compensated for, in exchange for your presentation, you would receive free admission to the conference as well as a vendor table at the conference. So please reach out to me for more info on that. I think that those are our May events.
And one last one for the Mental Health Association of Rhode Island. We're actually having our first walkathon on Saturday, May 31st. We hope it will be a really fun community event. Um, recovery and healing happen one step at a time, and that's the sentiment that I'll be carrying with me each step that I take on this walk. It's the 31st at Roger Williams Park, the Temple to Music. I think 9 o'clock the event begins, and I hope to see you there. More information can be found on the Mental Health Association's website on the events tab at the top.
I do see just a couple more questions that have popped into chat for me. One about whether the slides will be shared. To reiterate, yes, we will absolutely share the slides, and we will be sharing the recording of this event to anyone who registered. Also, I had a question regarding law enforcement and whether or not anyone partners with law enforcement to educate them about the proper way to handle a mental health crisis or to treat people who are living with mental health conditions? And the answer is yes. So there is an initiative in the state called CIT, which stands for Crisis Intervention Training. And the state police, corrections, and numerous municipalities have engaged with CIT training since its onset a couple of years ago. NAMI Rhode Island is a primary partner in that. We're on the strategic planning committee, but we also, for every time CIT is offered, we send some of our folks. They educate those law enforcement officers or trainees on programs and services in the community, including our own, but not limited to signs and symptoms of mental illness, suicide prevention and stigma reduction from our own programming. And then we have 3 individuals who go to that who share their stories of lived experience. They talk about experiences they had, one positive and one negative with law enforcement. So that way officers can hear, well, this is what didn't work for me, or what was really detrimental or scary, or whatever the case may be that was negative. And then they offset it with a positive story of an interaction they had with law enforcement that was handled well. So that's only a little piece of what CIT has to offer. But the intent of CIT is to train law enforcement officers or people who are coming up in that field during their education, to make sure that individuals who are called for a mental health crisis or receiving mental health response. Um, and I have a message in here about another, whatever your last event was that you mentioned. Lori Marie, would you just repeat that?
Yes, it's our first walkathon Saturday, May 31st, 9 o'clock. You can register on our website. If you go to mhari.org, you'll see at the top there's a section for events. If you click on events, you'll see the walkathon. Thank you for asking.
And actually, I was wondering what the last thing you talked about for NAMI was, Beth. I missed that. I had somebody at the door.
Our Bridging the Gaps conference, which is coming up on May 29th at
Okay,
the Crown Plaza. And I had also mentioned that we are currently still accepting proposals. If anyone has interest in offering a session on a program, service, or their organization, you can email me directly for more info if that applies.
have you sent out a flyer that I might have missed or?
So right now registration is not yet open, but we have sent
Okay,
out emails a handful of times for the call for proposals, as well as save the date. So it's gone out through our email listserv and on socials. But Carolyn, if you're not receiving those, let me know and I can just double check we have the right contact info for you in our database.
great. Thank you.
Thank you. And I don't see any further questions. Is there any last question or comment anyone would like to put into chat or speak to? Sabrina?
Hi, I just went online looking for the NAMI Smarts, and there's only one in person in Texas. Do they come up regularly?
So the NAMI Smarts, if you're looking for info on NAMI Smarts, you can go to the NAMI Rhode Island specific page as opposed to NAMI National. Sometimes their database, so the offerings come up when there's a specific date that's assigned to one, but that doesn't necessarily mean that states don't offer them that aren't listed. In Rhode Island, we can do an on-demand NAMI Smarts at any time that's like mutually beneficial if you have a group of 10 or more people. And if not, we will be posting very soon a couple that'll be taking place throughout the spring that are open to everyone. In addition to that, I am offering a NAMI Smarts, like a quick class within our Bridging the Gaps conference as well.
Okay, thank you.
Sure. Or you can also email me directly. I'm the state trainer for NAMI Smarts. Any other last questions or comments? Okay, seeing none, I'm going to stop the recording.